For those who are aged 40 to 60, the focus on skincare and treatments should be on anti-aging, hydration, collagen stimulation, and skin barrier protection. During the patient assessment, we look for pigmentary disorders, hydration, fine lines, skin laxity, and the management of pigmentation will be discussed in another video. When it comes to home care, the range of skin products can be overwhelming during assessment. One can divide skincare into two different categories. One is corrective and the other one is preventive. In other words, after the assessment, we then tell the patients what needs to be fixed and then what products we use to prevent further damage in the future. In general, the regime should not include more than 3 products at one time. This does not include use of cleanser and sun protection. The following list is by no means all the products listed, but it just gives you some idea of what can be used. For example, 1. Cleanser. We use a gentle hydrating cleanser. 2. We consider using antioxidants such as vitamin C serum. And 3. We consider using products that hydrate and also have barrier support. This could include niacinamide or hyaluronic acid. 4. The use of retinoids and retinol to improve fine lines, wrinkles, and skin texture. 5. The use of peptides and growth factors to support collagen production and skin repair. And finally, 6. Moisturizer, and 7. Sunscreen or sunblocks. In this age group, topical management is probably not enough to reverse and slow down the process of aging. In-clinic treatments combined with home care is more effective, it saves time and money. During skin assessment, we look for 5 key issues, but these are not in order of importance. 1 is we look at skin hydration. 2. We check for fine lines or wrinkles. 3. We look for volume loss. 4. We look for skin laxity or sagging. And 5. We look for dull skin. After the assessment, we come up with a management plan that address the specific age-related changes such as reduced collagen, decreased hydration, and accumulated environmental damage, ensuring that the skin remains as healthy, resilient, and as youthful as possible. The first item we talk about is using skin booster to rehydrate the skin using hyaluronic acid. You can refer to my other video on the importance of skin hydration and skin booster. And the use of botulinum toxin is to counteract dynamic wrinkles caused by repeated muscle movement. Dermal fillers are used to replenish the volume loss associated with aging. This can restore a more youthful contour, and there are some fillers that has collagen stimulation abilities. We assess the patient for sagging skin, and the aim is to stimulate collagen production. For skin tightening, we can use PDO monothreads or microneedle radiofrequency. For lifting, we can consider machines such as HIFU, high intensity focused ultrasound, which can reach deeper layer of the skin. The heat then triggers collagen and elastin production, tightening and lifting the skin over time. There are many options when dealing with dull skin, and some of the examples would include microneedling with PRP or exosomes or even PDRN to improve the skin texture. Chemical peels is often used, and one can also consider laser skin resurfacing. These treatments will help to remove dead skin and promote regeneration of new and smoother skin. Having a systematic approach will provide the patient with a treatment plan that the patient can understand in order to achieve optimal skin health.
Please like, subscribe, and comment. Please like, subscribe, and comment.